There are a number of respiratory disorders which affect people. The percentage of such disorder is particularly higher in Pakistan. It is due to the more concentration of air pollutants, not only in the urban but also in the rural atmosphere. Bronchitis is the inflammation of a bronchi or bronchioles. It results the excessive secretion of mucus into the tubes, leading to the swelling of tubular walls and narrowing of tubes. It is caused by various bacteria or exposure to chemical irritants. There are two major types of bronchitis, acute and chronic. The acute bronchitis usually lasts about 2 weeks and patients recover with no permanent damages to the bronchi or bronchioles. In chronic bronchitis, the bronchi develop chronic inflammation. It is usually lasts for 3 months of 2 years. Symptoms of bronchitis include a cough, mild wheezing, fever, chills, and shortness of breath. The majority of people diagnosed with chronic bronchitis are 45 years of age older. Emphysema is the destruction of the walls of the alveoli. It results in large sacs but with less surface area of gases exchange. As lungs tissues break down, the lungs do not come back to their original shapes after exhalation, so air cannot be pushed out and it is trapped into the lungs. The symptoms of emphysema include shortness of breath, fatigue, recurrent respiration infections, and weight loss. By the time the symptoms of emphysema appear, the patients are usually lost 50 to 70% of his her lungs tissues. The level of oxygen and blood may get to so low that it causes serious complications. Pneumonia is an infection of lung. In this infection affect both lungs, then it is called double pneumonia. The most common cause of pneumonia is a bacterium pneumonia. Some viral and fungal infection may also lead to pneumonia when the causative organism enter to the alveoli. They settle there and grow in number. They break the lungs tissues and the area becomes filled with fluid and pus. The symptoms of pneumonia include a cold that is followed by a high fever, shivering, and a cough with symptoms productions. Patients may become short of breath. The patient's skin's color may change and become dusky or purplish. It is due to poor oxygenation of blood. Vaccines are available to prevent pneumonia caused by pneumonia. Antibiotics are used in the treatment of these types of pneumonia. Asthma is a form of allergy which is there is inflammation of the bronchi, more mucus productions, and narrowing of the airways. In asthma patients, bronchi and bronchioles become sensitive to different allergens. Dust, smoke, perfumes, pollens. When exposed to any of such allergens, the sensitive airways show immediate and excessive response of constriction. In this condition, the patient feels difficulty in breathing. The symptoms of asthma vary from person to person. The major symptoms include shortness of breath, especially with excision at or at night, wheezing, whistling sound when breathing out, cough and chest tightness. The chemical with ability to dilate the bronchi and bronchioles are used in the treatment of asthma. Such medicines are given in the form of inhalers. Lung cancer is a disease of uncontrolled cell division in the tissue of lungs. The cells continue to divide without any control and form tumor. The cellular growth may also invade adjacent tissues beyond the lungs. The most common symptoms are shortness of breath, coughing including coughing up blood, and weighing weight loss. The main cause of any cancer include cancer such as those in cigarette smoke, ionizer radiations, and viral infection. Smoking is the main cause of lung cancer. This risk is of lung cancer is significantly lower in non-smokers. Cigarette smoke contain over 15 known passive smoking. The inhalation of smoke from another smoking is also a mass cause of lung cancer. The smoke from the burning end of the cigarette is more dangerous than the smoke from the filter end. Eliminating tobacco smoking is a primary goal in the prevention of lung cancer. The World Health Organization has called the government to stop tobacco advertising to prevent young people from taking up smoking. If a person stops smoking, the chance to develop cancer decreases as damage to the lungs is repaired and contaminant particles are gradually removed. Smoking is harmful due to the chemicals in cigarettes and smoke. Tobacco smoke contains over 4,000 different chemicals, out of which at least 50 are carcinogenic and many are poisonous. Nicotine is a powerful poison and was widely used as an insecticide in the past. When inhaled through tobacco smoking, it reaches our circulatory system and not only hardens the walls of the arteries but also damage the brain tissues. Many people think that lung cancer is the only smoking related disease, and it is the number one cause of death among smokers, but it is not right. Cigarettes smoke affects the body from head to toe. Smokers have a such higher risk of developing a number of life-threatening disease. According to the WHO, the rate of smoking have declined in the developed world. In the developing world, however, it is rising by 3.4% per year as of 2002 survey. Smoking may also lead to the cancer in kidneys, oral cavities. Smoking may also lead to the cancers in kidneys, oral cavities, larynx, breast, bladder, and pancreas. Many chemicals in tobacco smoke damage the air, which leads to emphysema and other respiratory disorders. Smoking also has effect on the circulatory system. The carbon monoxide present in tobacco smoke less the oxygen carrying capacity of homogeneous. Many other chemicals in smoke increase the production of blood platelets when the platelets are more